Okay, so hello and welcome. Wish I was in person with you all, but this is the next best thing. So my name is Amberly Haverstock. I'm the Community Impact Director with Lotus, which is your Children's Advocacy and Sexual Violence Resource Center. I have been working in this field of child abuse prevention since, I guess, the last 15 years in many different capacities with Lotus, and I've really had the privilege to witness the amazing resilience of children and survivors and families when they receive the support and services that they need when they need them. And also, I just get really excited about the work that we do out in the community and really just the feeding off that collective passion for really creating safer communities from all of you. So I appreciate you being here today. And so I'll talk a little bit more about Lotus and the services that we provide. And then also I'd like to kind of spend the last part of our time together today really talking about that shared responsibility for the safety of children in our community and what that looks like to create true primary prevention strategies to really create those safe and stable and nurturing relationships and environments for children. So starting off with who we are, you see this little drawing here. This was done by one of our child clients, and we love this one. They said it was the lotus flowers. You can see the little smiling faces here. And the quote, we changed our name in 2018. I guess I should say that too. So some folks may have known us over the years. We've been around since 1987 as other names, but we really felt like Lotus really embodied where we were in our current journey and where we were headed. And we refer back to this quote that just like the lotus, we too have the ability to rise from the mud, bloom out of the darkness, and radiate into the world. So who is Lotus? Our vision really is that freedom from oppression and violence. And our mission is to support survivors, to strengthen families, and to empower communities. And we rely on our values. We're grounded in our values of resilience and empowerment and diversity, equity, inclusion, and all the work that we do and all the interactions we have with our clients and our community. And we are really working to truly end, we know that it's possible to end child abuse and sexual violence. So a little bit about our services. So, what do we do here at Lotus? So we're a complex program. So I'll break that into the three components of our mission to help organize that for us today. So supporting survivors. So we work to improve those safety, healing, and justice outcomes through our specialized intervention and restorative services for children and adults, survivors, as well as their supported family members. We work to strengthen families. So we know that strong families are the best prevention for child abuse, and so that's why we really partner with families to foster that family resilience, to really truly empower caregivers, and to increase protective factors and keep children safer. And empowering communities. So we engage with youth and adults, our partners and allies, through those impact-driven community collaborations and outreach and prevention education, and our social justice advocacy, and all aim to prevent child abuse and sexual violence. So like I mentioned, we are a complex program. So we are a children's advocacy program, and we're also a sexual violence resource program, and we're Kentucky's designated each of those programs for this region, so for the 8 counties of the Purchase region. So our children's advocacy services include those forensic services. So we provide forensic interviews and medical examinations here at our on-site at our location by our team of very specialized trained professionals. And within this children's advocacy services, we're working really closely with something called the multidisciplinary team. So you should know that you have your own multidisciplinary team here in McCracken. If you're joining us from somewhere else, we facilitate 6 regional multidisciplinary teams. So each county, a couple of those are combined, have their own multidisciplinary team of professionals. That includes prosecutors and law enforcement, social services, and children's advocacy staff, just Lotus and medical professionals who are really working together to get the best outcomes for these children and families through child abuse cases. And so they're working to make sure that families receive the services that they need, nobody's falling through the cracks, and that our cases are moved through that criminal justice or family court process, which enables us to be able to create safer communities. Our advocacy services include those family advocacy services that really ensure support and education and resources for the families. And we're fortunate to live in a wonderful community with lots of resources, but it can be very overwhelming just to be able to even understand what a family needs when you just learn that your child's been sexually abused or physically abused. And going through that process, our family advocates really work to assess those different needs, not only at the beginning when we meet the family, but throughout their journey with us. And we also provide legal advocacy services. So if you've never been through the criminal justice process, which most of us have not, or the family court process, that can be really daunting, and there's a lot of unknowns, and families really need to know what to expect next. And so our legal advocates are really helping families to navigate the legal system, and not only navigate it, be able to successfully participate in that process. So throughout their journey to justice. Our therapy services, so we provide specialized mental health services, evidence-based treatments to help children really heal and recover from trauma that they've experienced. And we provide those evidence-based treatments and those integrative interventions, such as different restorative services like mindfulness and body work and movement. And those are provided on an individual basis as well as in a family therapy setting or a group basis. And so through our sexual violence resource program, got too happy with my clicking. Our sexual violence resource and our services, again, include SART. So what that means, we have a lot of acronyms in our world. So SART means Sexual Assault Response Team. So that's a lot like that multidisciplinary team that I mentioned for child abuse cases. We're working with the SART, which is made up of law enforcement, hospitals, so nurses, in our hospital emergency departments, as well as other folks in the community. And we're really working to improve that community response to victims of sexual violence. And so that enables, or I guess enhances the likelihood that our victims will actually make reports if they know that they're going to receive the support that they need when they make that report, because that takes a lot of courage. And it helps them to participate in that process, which lends to more successful prosecutions, and then that lends to more perpetrators receiving justice, and so creating safer communities. And our crisis response services, so we do have a 24-hour crisis response helpline that folks can contact, and we also respond 24 hours a day to hospital emergency departments. So when a victim reports to the emergency department after an assault, they contact us, and we send a trained advocate to provide that medical advocacy in that setting. We also provide those advocacy and support services. So we, again, connecting folks to resources and really just supporting them through whatever stage of their process that they are in. And again, those evidence-based, therapeutic and restorative services to truly help victims and survivors really heal and reclaim their lives and really use their body as a tool for recovery. So I said we would spend the latter part of our time together, majority maybe of our time together, talking about empowering communities and really that community approach to creating those safe, stable, nurturing environments for children and families to truly prevent child abuse from happening. So we believe in empowering communities. That's part of our mission statement because we do know that together we can end violence. Our goal is to really invoke those shared values with you to help to deepen understanding, which I hope that we'll do today together, and to really amplify our collective impact because it really does take all of us to do this. And so through empowering communities, we provide prevention education programming. So we provide that evidence-based programming using those prevention strategies across the human lifespan. So we have evidence-based programs that we go into the schools with the pre-K and our kindergarten through fifth graders. We're working with them, and then we have evidence-based program for our middle school age, our high school age, and also with adults. And through our community outreach and engagement, we're really working to engage and really cultivate community to be able to expand our resources and, like I said, to amplify that collective impact that we can have together, and to strengthen the research and the education and the advocacy that really is aimed at improving the overall health and well-being of our community. So, like I said, we believe in primary prevention strategies. So that means preventing the harm or the abuse before it happens, before it can have the negative effects. Yes, we provide intervention services, and those are very important. And those prevention programs, like I was speaking about with the kids in the school, that's very important. But these primary prevention strategies really are what will help us prevent future child abuse and neglect. And so we know, like I said earlier, I'll say it again, we know that strong families are the best prevention for child abuse. According to the Center for Disease Control, we know that safe, stable, and nurturing environments are really essential to prevent child abuse and neglect and to assure that all children reach their full potential. Which I feel like we could all agree that is something that a collective interest that we share together. So we're really working, and you see here, for strengthened families and that optimal child development and that prevention of child abuse and neglect. So why does this matter? So we know that child abuse and neglect are significant public health problems in our nation. Statistics show, you may have heard this before, that 1 in 4 children in the United States experiences some form of child abuse and neglect in their childhood. And we also know that children may, besides child abuse and neglect, children may experience other adverse experiences during childhood. So those are called ACEs. Some or all of you may have heard of those. I guess there's a lot more research coming out, gratefully, about ACEs and the impact. So I hope that we're deepening the understanding around ACEs. That can be children that are living in the home with someone with a mental illness or a drug addiction. Children may have witnessed violence in the home. They may have been experienced violence by an older child in their life. But those ACEs and child abuse and neglect really can cause high levels of what we call toxic stress. So that stress that can literally rewire a child's brain and their cognitive and their emotional, and really affect their development. And so we know that children who experience child abuse and neglect and other ACEs are more likely to engage in risky behaviors in adolescence, and also to have health problems as adults. And so you can see some of those health problems as adults. Folks are more likely to have alcohol abuse, depression, eating disorders, drug abuse, smoking, contract STDs, suicide, chronic diseases, obesity, and violence towards others. And when you consider that surveys of adults show that 62% of adults report experiencing at least one ACE in their lifetime, and 1 in 4 adults report experiencing at least 3 or more ACEs in their lifetime. And also, surveys of caregivers have revealed that caregivers report that children show at least 22% of children experience at least 1 or 2 or more ACEs as a child. And so when you're putting all these things together and considering that, there are a lot of us in our community, in our state, and in our nation who are experiencing these ACEs. And so if we can get on the front end of this and help to prevent these ACEs from occurring, including child abuse and neglect, then just think about the positive impact that we can have. So really the goal, we want to help children reach their full potential. That's good for a lot of ways. A lot of people we say children people. A lot of people are family people. A lot of people are community people. We all care about different things. But what we know is that helping children reach their full potential helps families, right? And helps communities be more successful. We know there's those 3 critical qualities of safety, stability, and nurturing. And so safety including, when a child feels safe from that fear, anxiety, from any type of physical or psychological harm within their physical environment. And stability, the degree of predictability or consistency in that child's environment. And do they, experience nurturing? So are their physical, emotional, and developmental needs being consistently met by the adults in their lives? And we know that buffering children from these effects of stressors, such as ACEs and child abuse and neglect, can have a positive impact on that broad range of health problems and on the development of skills that children, as their little brains are developing, the development of those skills that can help them reach their full potential and really just create that equity within our systems. Picture's not allowed here. Oops. Bear with me. Okay, and so again, those safe, stable, and nurturing relationships and environments. So environments for children may help to not only reduce the occurrence of child abuse, neglect, and ACEs, but also reduce those negative effects that we've talked about of child abuse and neglect and of ACEs. And again, improve that physical and cognitive and emotional outcomes throughout a child's life. And reduce those health inequities that we talked about, and just really have like a large cumulative impact on the health of individuals. So, check my time. So for the last of our time together, the question that I wanted to ask myself was, so what can we do? And I think a great place to start, and where we are starting at Lotus, is really to raise that awareness, and not only awareness, but commitment to promote those safe and stable and nurturing relationships and environments where all children and families can thrive. And so the way that we do that is through changing our beliefs and attitudes and behaviors. So we need to, as a community, believe that the solution to preventing child maltreatment exists in our communities. It's here. We need to believe that we all have a role to play, each of us. And those behaviors, we all have a role to play, even if it's just even if it's checking in on families. Now is a really stressful time for a lot of families. Just checking in a safe way with families to offer some type of, take a meal over, or watch the kid out in the yard, help relieve stress on caregivers. We know that we need to change our norms. So again, creating that shift from it's the responsibility of the parent or the caregiver to make sure that their child's okay, to it's a shift to a shared responsibility. So it's my responsibility, it's your responsibility, it's all of us have responsibility for the well-being of children in our community. And that shift in those norms of, oh, well, they're just a bad parent, to really emphasizing that we all, I have 2 girls, and trust me, I need help. We all need help at times as parents and caregivers. So really shifting that norm can help raise that awareness and that commitment and changing our programs. So we want to, build community reception and capacity and resources to be able to implement evidence-based parent programs, and to teach caregivers positive parenting and child management skills. And again, going back to the social norm, but not thinking that's a bad thing, that you need help with that, but that we all need help with parenting. And so at Lotus, we provide the Nurturing Parenting Program, and really work within the Strengthening Families and Communities initiative within our region, and provide those parent cafes and parent support. We need to change policies, and you can see, like, as you kind of go down, it gets a little bit more maybe difficult or over more time to be able to change these things, but we need to change policies. One example of that is really working with our businesses and organizations to embrace those family-friendly work policies. So families need livable wages. They need to be able to provide for their family while they're working. They need paid leave. And so I think that COVID probably has really highlighted the inequity here a lot in our community. Some people don't have a choice. Some people don't have paid leave, but families need paid leave, and families need those flexible but yet consistent schedules. So really working to encourage our community to embrace those family-friendly work policies. And we need to change systems. So I attended a seminar this week, and with the CEO of Prevent Child Abuse America. She's a child psychiatrist, and I really like what she said. So I stole that and put it in here, and I'll give her the credit. But changing our child and family, we need to change to a child and family well-being system versus a child welfare system. So I like that, a child and family well-being system, not a child welfare, if I can say the word, system. And really ensure, and we've been working at Lotus to do this over the several years, really working to ensure trauma-informed systems. So all those systems that are coming into play with children, with families, with survivors, making sure that they're trauma-informed in their practices and their policies, down to the way they arrange their furniture in the waiting rooms, right? And really ensuring that quality care and education early in life. We're fortunate, like I said, to have a lot of resources. So we have great Head Start program here in McCracken County. But again, that quality care, so really making sure that those early childhood care providers have the best education they can about knowledge of child development, helping with social emotional learning, all of those things, just really kind of raising the bar for our early childhood care facilities can help to change systems. So I think the next question for all of us is, are we committed? So are we committed as individuals and a community to that vision of a safe and stable and nurturing relationships and environments for all children and families, and are we willing to take action to support that vision? And so I would like for us to just kind of reflect on that. Are we committed? And I would invite us to think about, to imagine, what would the leaves of our, say we had a community tree, we'll use this visual of a tree. What would our community tree be if, we were grounded in the roots of resilience and empowerment, and diversity and equity and inclusion? So if we can think about that, and I would offer that if we are committed to creating those safe, nurturing, stable relationships for children, all children and families in our community, and if we are grounded in the roots of resilience and empowerment and diversity, equity, inclusion, that together we will hope, heal, and grow. So thank you again for joining me. And I've got my contact information here. We can take questions if anybody has questions today, if I can find the next slide. I've got my contact information here, and also if you are curious and would like more information, you can go to our website at hopehealgrow.org. There's lots of information and resources there for you to explore, and then also highly recommend the CDC's website for violence prevention. And again, just thank you for joining me today, and email me with any comments or questions, or if you'd like to be involved or know more. So thank you, and together, let's hope, heal, and grow.
Any questions and comments? If not, we thank you so much, Amberly, for being part of our McLib Live virtual program today. This program will be on our library's YouTube, so please take advantage and share this vital program with family and friends and colleagues. Thank you so much for being here today.
Thank you.